It's a Northwest Lifestyle Weekend on KOMO News. IRG's Health Talk continues.
First guest today, Dr. Tony Trinh, an MD at Polyclinic, and talking about travel medicine. Shannon, everybody's getting set to travel here this summer vacation time. Actually, interestingly enough, there was a statistic I heard the other day that 1/4 of us do not take summer vacations because simply they can't afford it, which is sad. You know, you want to use those summertime vacations, but a lot of people will be traveling, and there's some things you need to be aware of with regard to your health.
Particularly when you're traveling abroad or overseas. I mean, let's talk about like Zika virus, right? I mean, where'd that come from? So yeah, Tony's going to talk about that.
All right, let's hear Dr. Tony Trinh and Shannon O'Kelly.
Dr. Trinh, welcome to Health Talk. How are you doing today?
I'm doing fine, thank you.
Tell me a little bit about your practice, what your interest is, your specialty. You work at the Polyclinic, but tell us how you got there.
I work with 4 other doctors at the Polyclinic Travel Center. We specialize in travel medicine, and we are all board certified in infectious diseases. I got my board certification in infectious diseases and all of my training in that, so I'm a board certified internist as well, and then get into infectious diseases. And part of that is to learn how to prevent certain diseases and picking up some illnesses, and travel medicine is a great platform to do that.
A particular interest personally on your side, traveling?
I used to live in Sub Saharan Africa, so I have a good bit of travel experience myself. So malaria, traveler's diarrhea, yellow fever, all those things are things I don't personally have experience with, but thankfully I have personal experience in preventing those things.
So tell us about travel medicine. I mean, let's start. Let's do A to Z if we can here. Mm-hmm. So, I mean, it obviously depends on what part of the world you're traveling to. Do you have the top 10 tips or 5 tips when you travel, how you should prepare, get ready for vaccinations? I mean, all the stuff that we need to be aware of when we travel abroad.
Exactly. Traveling is a wonderful thing of this day and age. You know, everything's so interconnected, and so I think travel breeds content, and travel just builds character, and travel is just one of the wonderful things that a human living in 2018 can do these days. That being said, there are risks of traveling, and especially going to the more exotic places. So I think you have to do a good job planning before you go, and then planning on when you're there, and then afterwards. At the travel clinic, we like to ask people to give themselves maybe at least 4 to 6 weeks prior to traveling to check in with their healthcare provider, us or even their primary care providers. That way they can have someone, either myself or their primary care provider, to go through their travel itinerary, their activities, and review their pertinent medical history to give them the best chance to stay safe and healthy when they're on their travels. And then we give them tips while they're on their travels, again, depending on their activities, best way to troubleshoot and stay safe and stay away from sort of picking up anything that they don't want to pick up. Hopefully it's just souvenirs and not the runs, but that does happen. And then when you come back, there are things that you may want to watch out for. You can pick up colds and even feel sick when you come back, and so we are there also to provide medical services afterwards.
Out of curiosity, if I was to go talk to my family physician and I'm getting ready to travel to an exotic place, what kind of things should we have a conversation about? I mean, up-to-date vaccinations. I mean, give us an idea of what you want to talk about when you go to that travel doctor like yourself.
Yeah, vaccinations are the best way to protect yourself against, say, things that are lurking out in the environment to where you may be traveling to. I think a comprehensive review of vaccination history is very, very important. I like to conceptualize things in how you can get sick when you do travel. And for the most part, it's foodborne illnesses that you want to watch out for. So you want to make sure you're up to date against vaccines, vaccine preventable conditions that you can contract through, say, food or food contamination. And then you want to review what are your risks of bug-borne diseases, mosquito-borne diseases. Mm-hmm. So a lot of people like to travel to exotic places, again, like Sub Saharan Africa or the Amazon. And those are wonderful places, but insects can carry certain diseases that you would want to watch out for. Things like malaria and yellow fever. These things that seem to be in the history books here in the U.S., but are present day in these areas. And then you want to make sure that you want to protect yourself against animal-borne diseases, such as being bit by stray dogs or bats or, God forbid, humans or monkeys. but that does happen.
We're talking with Dr. Tony Trinh and Shannon O'Kelly on travel medicine. If you'd like more information on Dr. Trinh, polyclinic.com, and we'll get the second part of our interview with Tony coming up right after this time out on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. Now back to IRG's Health Talk.
All right, we're back and continuing our conversation with Dr. Tony Trinh, something that a lot of times we don't think about until it all of a sudden hits us, but that's staying healthy where you're traveling. We're talking about travel medicine with Dr. Trinh, who is an MD at the Polyclinic. More information at polyclinic.com. Here's our conversation with Dr. Tony Trinh and Shannon O'Kelly on KOMO.
Dr. Trinh, again, thank you for joining us, and thank you for enlightening our listeners, and particularly myself, on travel medicine and the concerns and things you should look at before you travel. But let's talk about you're there. You've arrived in this exotic land, and you talk about foodborne. But what about water, and what kind of things should you watch for when you're ordering and eating in these places that maybe there's more exposure to diseases based on food you eat and water you drink?
Exactly. What I tell my clients is you're there to have fun, but you do have to have an amount of caution around you. And you're not going to be going there with, say, you talk about waterborne diseases. And water and food I do put in the same category because it's about consumption. It's really what you put in your mouth. Most of my clients don't go with water testing kits to see if this is a good water or not. Many times, that's part of the planning process of where you're going. Many places that are even if it's an underdeveloped country, are in well-developed areas. So for my folks who do sort of luxury travel, for the most part, those hotels have been vetted and fitted with good water systems. So when I have clients that just go to high-end hotels, I'm usually okay with them they can clearly use the tap. They should shower. They can probably be safe with those things. If your activity is more off the beaten path, more in the bush, you're camping, you're real rugged, that's when I say you should practice higher caution around sort of what you consume in water. And water is the biggest one. So bottled water is probably the safest way to consume water when you're in maybe not so lavish settings. So I usually say bottled water, and there are kits that you can take with you that you can get at REI, for instance, that will help sort of sterilize the water from where you're traveling. So a lot of that is just a gestalt situation set around where your activities and what you're going to be doing. For the most part, that's really what I say regarding water. Now, food similarly, there's nothing sort of dangerous about, say, fruits and vegetables in some of these developing areas. In fact, some of them have the best fruit in the world. But people have some precautions over them, and it's, again, because of the water. It's how it's usually cleaned and prepared. So if you can sort of trust, if it's, again, nice hotels, you can probably be okay with that ice cube or that water or that salad. If it's maybe on the side of the road in sort of the jungle, you may want to stay away from it. It's really about what you think is serviced by well water. And so a lot of these developing areas that are sort of off the beaten path are usually sourced by well water, and I would stay away from consuming water from the tap in those areas.
I mean, obviously, if one comes to your clinic, I mean, you're going to review everything, and your goal is that both you and your client have a successful vacation and stay healthy, and that makes the best vacation. Thank you for your time, and it sounds like you have a great job.
Yeah, I love what I do.
Well, it's a fascinating topic, travel medicine, Shannon. You know, people are always worried about getting sick in an airplane, the germs that float around in there. But then you get overseas. If something were to go wrong, it's really important to have a little bit of a plan going in when you're traveling.
It's a pretty common area of medicine in today's world because people like to go see the doctor and find out, what do I need, vaccination, et cetera, when they travel.
All right. Our next guest, Dr. Padmini Bhaskar, is going to talk about healthy aging as we continue with IRG Physical and Hand Therapy's Health Talk after this time out on KOMO.